Hi, everyone. Thank you so much for joining Wake Up Narcolepsy for this early access World Narcolepsy Day International panel. We are so excited to hear from all of our panelists and learn more about narcolepsy around the world. Before we get started, I just wanted to quickly thank our awareness sponsors that make events like this possible. Those are Alkermes, Avadel Pharmaceuticals, Axum Therapeutics, Jazz Pharmaceuticals, and Takeda Pharmaceutical. Our host for the panel tonight will be Matt Horsnell. With that, it is my pleasure to turn the stage over to Matt.
Yeah, thank you so much, Kara, for the introduction. Thank you to Wake Up Narcolepsy for the honor of facilitating this conversation. This is the third year that we've had a chance to do it, and it grows every year. We've got advocates representing 6 continents, not 7, Kelsey. But look forward to one day hopefully having Antarctica represented. And I want to thank all the co-leaders who have helped put this together. Wake Up Narcolepsy has been a huge champion of this day and helping raise awareness. I want to thank all the panelists who you're going to hear from tonight, and also the organizations they represent. And I just want to encourage them to make sure that they include those organizations that they proudly represent. I'm just going to go through the names alphabetically, and then we can go through some introductions. So from the United States, we have Diana Anderson. From Canada, we have Kelsey. We have Ana Braga from Brazil. Juliana Angeline is going to be helping with any translations for her. Diana Brooks from the United States. Felicia Elisabeth, who can speak about both Thailand and experiences in Indonesia. Fiona from Australia. Maryanne in Njũgũna. Did I say that right? I've been practicing. I hope I got that one correct. Rorey Smith, Shelly Gonzalez of the U.S., and Roy Smith of the U.S., and then Sanem from Turkey. And so with that, I would like to ask Anna and Juliana, if you can help with this, to give a little intro, including kind of name, what part of the country she's from, her diagnosis, age of onset, and age of diagnosis.
Hi, I don't speak English very well. Não falo nada, mas é um prazer estar aqui com vocês. E Juliana vai falar por mim, mas o importante é estar aqui participando, gente. Muito obrigada.
So Anna is thanking everyone, and she's very happy to be here. She's very honored. So she's from Brazil. She's from Rio de Janeiro, and she has narcolepsy type 1.
Aos 30 anos apareceram os primeiros sintomas e o diagnóstico aos 42 anos, 12 anos de busca.
So the first symptoms were when she was 30 years old, and she was diagnosed at 42 years old. So it took 12 years from the beginning of the symptoms till the diagnosis.
Thank you, Juliana, and thank you, Anna. I have to say that the work that you guys are both doing at Abrani is one of my favorite things to see on World Narcolepsy Day. Just continuous posts and so much excitement and enthusiasm. So thank you to both for being here. Diana?
Hi, I'm Diana Anderson, and I live in Knoxville, Tennessee, United States. And I have narcolepsy type 2, or narcolepsy without cataplexy. I had symptoms starting when I was around 24 years old, and I was diagnosed at the age of 34. So about a 10-year delay in diagnosis for me.
Yeah, thank you, Diana. And that actually brings us to Diana Brooks, who I've had the pleasure of knowing for I guess now almost 5 years. She's been a great friend, and I affectionately refer to her as Narcolepsy Mom, and I will let her kind of explain that a little bit more. But Diana Brooks.
Hi, and thank you so much, Matt, for including me in this wonderful group of people. I live in Denver currently, Denver, Colorado, from the United States, and I have 3 kids with narcolepsy. 2 have been diagnosed with type 1. 1 has been diagnosed with idiopathic hypersomnia, but we believe that idiopathic hypersomnia has progressed into type 1. So the first one is currently, she's 27. She just got married. She started showing symptoms at 13 and she was diagnosed at 15. My son, who is the oldest, was diagnosed at 21. He started showing symptoms probably about 2021. He got sick when he was studying abroad with the flu and started noticing symptoms right away, and we quickly got a diagnosis. And my youngest also was very quick. And she was 19. She was a freshman in college, had mono, and it triggered symptoms for her. So she is, she'll be 23 in 5 days. So
Yeah.
Thank you again.
Yeah, thank you, Diana. And just so much love in that family. Truly grateful to count you as a friend. Felicia, would you like to share a little bit about your story, about where you're from? I know you've moved a little bit, and tell us a little bit about your age of onset and then age of diagnosis.
Hi, everybody. My name is Felicia, and I'm from Indonesia, but currently living in Thailand. So I study master's here. I got diagnosed with narcolepsy with cataplexy at age 20. I got diagnosed on 2021, and my first symptoms is when I'm in the middle school. So it's been about 10 years. Yeah, it took me 10 years.
Thank you so much, Felicia. I think for those watching, I think you're seeing a trend. There is certainly a decades-long diagnosis journey for so many. Let's go with my Australian friend, Fiona. We actually were in Rising Voices together a couple years ago now, but she's been one of my longest running friends with narcolepsy. So Fiona, would you please do an introduction?
Yeah, hi everyone. My name's Fiona and I'm 53 years of age. I was born in Port Moresby, Papua New Guinea, but moved to Brisbane, Australia with my family in 1985 and have been living here ever since. I was diagnosed with type 1 narcolepsy, so narcolepsy with cataplexy, in March 2017. I was approximately 40 years old when my symptoms first started, and I was 47 years old when I was diagnosed.
So much for joining us, Fiona. And it's officially World Narcolepsy Day in Australia, and I think also in Indonesia and Kenya too. Just wanted to acknowledge that. So we can definitely say we've kickstarted this day off in certain parts of the globe. Let's go with Kelsey. Would you like to do an introduction?
Sure. My name is Kelsey Bingham. I live in New Brunswick, Canada, which is on the Atlantic coast. I was diagnosed with type 1 narcolepsy in February of 2020. I'm not sure exactly about symptom onset. I had mono in the summer between grade 8 and grade 9, and then I had another bout the year after I graduated from high school, and then I had a really bad bout with the flu in about 2001, and my symptoms got progressively worse with each one, but I did not develop cataplexy until after that last bout of the flu. Fortunately, I was misdiagnosed with depression as being the reason I was so tired, and so the medication they gave me for depression suppressed my cataplexy, and it took another 20 years after that misdiagnosis before I got my diagnosis with narcolepsy, because the cataplexy, which probably would have been the most evident symptoms, was masked.
Thank you so much for joining us, Kelsey. Let's go with Maryanne.
Good morning from Nairobi, Kenya. My name is Maryanne Njũgũna. I'm currently based in Nairobi, and I live with narcolepsy type 1 with cataplexy, and my symptoms onset was when I was 14 years old, new in high school. and I was diagnosed at the age of 19 when I was in college. Yeah, and also I represent Narcolepsy Africa Foundation. Thank you.
Thank you so much, Maryanne. It's great to have you here today. Rorey, would you like to introduce yourself?
Sure. Hello, everybody. My name is Rorey Smith, and I live in the Commonwealth of Virginia, United States. My onset of symptoms was around 49 years old, but I'm going to break the cycle here. And my diagnosis was at 50. So like maybe 7 or so months. But I had Lyme disease that I didn't know I had. And so after that, within like 2 years or so, I was diagnosed with 3 autoimmune conditions, which narcolepsy is one of them. So it was pretty fast.
So much, Rorey. And I think it underscores too, while there's so many similarities that we share, there's also some subtle differences, both in onset, but also with presentation as well. So I really appreciate you being here from the Commonwealth of Virginia. That's how I'm always going to introduce you from now on. Let's go with Sanem. Would you please introduce yourself and tell us a little bit about you?
I'm Sanem from Turkey. I'm 20, and I have diagnosed with narcolepsy. I had some symptoms 2 years ago, and I was diagnosed with activity.
Yeah, thank you so much. And we appreciate you joining us from Turkey. Thank you so much, Sanem. Shelly, would you introduce yourself?
Hi, I'm Shelly. My diagnosis, I'm from Missouri in the United States. My diagnosis is idiopathic hypersomnia. My symptom onset was probably around 14-ish, 15 years of age. My diagnosis happened when I was 31, so there was a few years there. Similar issues with misdiagnoses, and not really anyone looking at the sleep stuff until my early 30s. Yeah, that's who I am.
Thank you so much for being here, Shelly. And then last and certainly not least, the jet setter himself, Feri. Would you please do an introduction?
Good night, everyone. It's after midnight here in the Netherlands. My name is Feri Ascencion, and I'm a patient advocate for the past 10 years. I got narcolepsy type 1 for about 27 years now. I am 56, and I was lucky that I got my diagnosis within about 6 months after onset. That's quite exceptional.
It's great to have you here, bud. And Feri's representing PWN for PWN. For those keeping track at home, we have, I think, 5 or 6 global organizations represented. And again, I think that's just consistent with the effort here. I want to jump right into conversations about challenges in your own country, because I think that's, we each have unique challenges in our journey and in our home country. But I just want to kind of illuminate some of those. Particularly with regards to kind of where you are to geographically in your country. So if you're from the United States, if you have some local challenges, if you live in a rural area, we'd love to hear that perspective as well. So I'm going to start off with Anna.
Dos principais desafios que a gente tem é o desconhecimento, a falta de informação dos médicos, a falta de investimento em uma política de promoção de saúde do sono, porque hoje nós entendemos que enquanto o sono não for considerado um problema de saúde pública, a gente não vai conseguir diminuir o tempo do diagnóstico, porque alguns estados sequer têm o teste de múltiplas latências.
She said that the lack of knowledge among doctors is one of the big problems here in Brazil. There is also some difficult to access the exams, and she thinks that the biggest problem of all is the lack of a public policy that considers the sleep as a public health problem, and therefore there is no investment in exams, and they are not available in the small cities. They are available only the big capitals, and there's no investment from the government, and I think that's it.
Very well said, both Anna, and thank you for translating, Juliana. I think we're going to find that might be a common theme throughout. So let's go with Diana Anderson.
Thank you, Matt. And yeah, I think I can definitely resonate with Anna in saying that I believe some of the challenges here in the United States is also, healthcare providers having sleep disorders, diagnoses on their radar when they are evaluating patients. A lot of times they're often, can be misdiagnosed with depression or, fatigue or, whatever it may be. The first thought process isn't always, oh, maybe there's an underlying sleep disorder causing this person's symptoms. So I would say that definitely is a challenge. Additionally, I would say in the United States, there are many different types of insurance, health insurance plans, and there are some that will only allow someone to go to a specialty physician like a sleep specialist if they get a referral from their primary care doctor or their general practitioner. So they have to oftentimes go through loopholes. And then if someone is on a fixed income or a tight budget, then they may not be able to pay for that primary care visit, let alone then a specialty copay once they are finally referred to the appropriate sleep specialist.
Diana Brooks, you've actually got 3 sample sizes or 3 samples to kind of pull from there. So interested to hear your answer.
Yes, well, I agree with Anna and Diana about all the points that they hit. The first diagnosis was the hardest. We were fortunate that the other 2 actually, the doctor was quite giddy when she found out there was a second and then a third. There's been a study written on my family, so it's called 3 Sleepy Siblings. it's hard to say, but the first one, we went through a pediatrician, and her blood work was fine. She's very athletic. She looked great, and he said, she's great. Nothing's wrong with her. And I'm like, no, something is definitely wrong with her. And it was really myself Googling symptoms and finding out once she fell in the kitchen. So it took a long time in my eyes, it wasn't a long time compared to most of you, but as a mom watching your child fall asleep in her books, like literally just anytime she would get in the car, she was sound asleep. So, it was just an odd thing. I had teachers calling and stuff. So finding somebody, we even had a pediatric neurologist that said she was fine. Nothing's wrong with her. So never wanted to go to the sleep study. And so making doctors aware, all the doctors, the young doctors that my kids now are in college and post-grad and things, any of their friends that are going into medicine, I'm always like, just look at narcolepsy, make sure, how much do you get? They don't get enough. They don't get enough on sleep. So I also find it very difficult about finding practitioners. Once you have a good practitioner, if you move to another state, you have to find a new practitioner. So those things are all very troublesome. So I don't know that our story isn't super interesting on the second and third level because, we did see, the kids see a very well-known doctor in Atlanta.
I certainly think it's interesting on a lot of levels, but I think you really articulated well the challenges when you move. And I think that's something that so many of us has faced too. or when their doctor says, I'm retiring, and you just get that panic over your face of, oh, I have to make a decision now. Let's go with Felicia. I'd love to hear about your experiences.
I was diagnosed in Indonesia, so I'm agree with Anna that in Indonesia there are also gaps in many aspects. The thing is, first, we don't have many specialists that familiar with narcolepsy. Not just like narcolepsy, but I mean like the sleep specialist is very few. And also Indonesia has many islands, but based on my experience, not until I moved to the capital city, the Jakarta, that I could get the proper treatment. And even in Jakarta, very few hospital capable to do the MSLT test. So as far as I know, only like less than 5 doctors could perform the test. And also in Indonesia, we have like the government insurance. So everyone have that insurance from the government, but the test itself doesn't covered by the insurance. So if you don't have the budget, then you cannot access it. Yeah.
Thank you so much for sharing that, Felicia. And it was an interesting reminder that how geography can prove a huge challenge when you're trying to get from one place to another. You know, it's easy for us in the United States to think about just hop on the highway, but there's logistical challenges that exist outside of that. So thank you for sharing that. Let's go with Fiona.
So I think lack of education among health professionals is still one of the biggest challenges in Australia. Many health professionals, in particular GPs, have never heard of narcolepsy or know very little about it. This results in them not always recognising the symptoms when patients present with narcolepsy, which in turn means both misdiagnosis for the patient and or a delay in a diagnosis, sometimes up to 10 years. It also means patients aren't able to access medications and services they need in a timely manner. And for some patients, I think, depending on how many other specialists that they're referred to before finally seeing a sleep specialist, the cost can be huge, particularly if they don't have private health insurance, and it can be a long wait in the public system. So, which again results in a delay of diagnosis and access to effective treatment because they simply can't afford to keep seeking answers. And I'm just going to add in that too, that I think, or in my case especially, I think the cost to an individual's mental health during this time can also be really high.
Yeah, that's a wonderful point there too, because it's not just the time, it's the mental health toll as well. So very, very well said. Kelsey?
Well, I can't speak for all of Canada. I live in a very small province, less than 1 million people, and there are only 2 sleep specialists in my entire province. I'm very fortunate, though, in that I live in one of the cities where one of them is located. So once I got referred to the sleep specialist, my diagnosis actually happened fairly quickly, like within 6 months. The problem was the delay in getting referred because, like everybody else so far, my primary care physicians like narcolepsy wasn't on their radar. Any type of sleep disorder wasn't on their radar. And I went to them yearly, more than yearly in some cases, saying, I feel like I have mono. I feel like I did when I had mono. And they would check my blood and they'd say, you're fine. Your blood panel is perfect. There's nothing wrong with you. And I'm like, no, there's something wrong with me. There must be some other kind of test you can run. And they're like, no, there's nothing. It must be depression. We'll give you antidepressants and see how that works. And so fortunately or unfortunately, I don't know, the antidepressants they gave me happened to be the #1 treatment for narcolepsy at that time, because this was 20 years ago. You know, it masked my cataplexy, but it also did help improve my symptoms somewhat, not very well, but better. There was some improvement. So they said, oh, okay, well, then we're on the right track. We'll just keep upping your antidepressants. But every year I would still be complaining. And I think the old adage there, if you hear hoofbeats, think horses, not zebras. I'm like, no, think unicorns, like think sleep disorders and get those, referrals out there. Listen listen to what your patients are saying. It was actually my psychologist who referred me to this, thought that I had a sleep disorder, and got me to seek out the referral for that. Because he was the one who was saying, you're not depressed. Like, even though my primary care physician was insisting that's what it had to have been. And he's like, no, you're not depressed. There's something else here. And so, but for a lot of people in my province, there's also the issue of just getting to one of the two sleep specialists. And although healthcare, there's universal healthcare in Canada, there's not universal pharmacare. So even once you get your diagnosis, you still have the issue of, can you afford the medications? If you work, there's usually health insurance that will cover your medications through your work. But if you're not working, which a lot of people with narcolepsy aren't, unless you are already on a plan, it's considered pre-existing, and they won't cover it under the private ones, and the public ones will only cover, your basic inexpensive narcolepsy medications, and not any of the new, more effective ones. So that's I think one of the bigger struggles here.
Maryanne, I'd love to hear a little bit about some of the challenges to receiving a diagnosis in Kenya and around Nairobi.
Yes, okay, thank you for the opportunity. My symptoms started when I was joining high school, and then by then most of the doctors that I visited thought that it was puberty. I was having struggles with puberty, so they said it will soon go away. But like, I used to go to the hospital like every term, whereby other doctors will take a blood sample or general tests and say that I'm okay. By the time, like 3 years down the line, some of the doctors told my mother upfront that I didn't want to go to school, that I should I should drop out of school because I was wasting my mother's precious time, her always taking me for checkup, and the results are always the same. So by the time I reached, before I got near diagnosis, once the doctors were dismissive of my symptoms, my mom and I thought that maybe I was bewitched, the traditional part of our African society. So she had me visiting some religious leaders for prayers, being given ointment for cleansing, but the sleep never went away. So by the time I was in my final year in high school, my mom just told me to she has done everything that she could possibly to have me diagnosed for a condition. So I've come this far, so I should just learn to live with the symptoms. So when I was about to do my final exams, we had some psychiatrists visit our school, and they caught me sleeping during one of the prepping sessions. And then I had to approach one of them during break time and showed him my book. I actually didn't have any notes all the 4 years I was in high school, because every time I sat down to write notes, I would fall asleep, and then I didn't have clear notes to read. So I told him, due to these challenges, I only have one notebook, because even the school did not give me other notebooks because of blacking out the pages. So when I explained to him this is normally what happens, I only realized that I had fallen asleep when I woke up. And then that psychiatrist was the one who pointed us to help. And now the irony is, the hospital that I was diagnosed with narcolepsy, I had visited it 6 months before, and I was actually chased away because everything was fine with me. I was just wasting my parents' time. But now he insisted and I was sent to a mental health clinic where like 3 months later, that's when I was diagnosed. And then before like continuing with the mental health clinic, my mom didn't want me to go through because of this issue with mental health in our country, whereby it is associated with people like with severe cases of mental health issues. So having me going to the clinic was like accepting that I was one of these people, but at least now it changed the narrative. Yeah, so it took me 5 years to get diagnosis, and yeah, it was a journey of ups and downs. Thanks.
Thank you so much, Maryanne. And I think you underscored a whole lot, like the dismissive nature of physicians. There was cultural challenges, and there was stigma associated with not just sleep disorders, but mental health. So, I'm grateful to have watched your career kind of blossom and you be a great advocate, both on social media, just and out in the world. So it's been great to see your story unfold and know you're out there making such a big difference in it. And I think a country and a continent that really needs it. Let's go with Rorey.
Mine are actually twofold for my diagnosis. The first one, a lot of people already touched on, and that's having doctors are not familiar with narcolepsy. And in fact, I saw probably 6 or 7 specialists. And, I got a range from, oh, you just need to exercise, you're too fat, to, you just need to, go do something fun. I mean, just silly things. So it took a little bit of time to get through that. But once I found a sleep doctor, my issue then was I didn't fit the profile, right? Because I was older, I was around, 50. And so that wasn't something that even the sleep doctor was thinking this was possible. And he kept focusing on sleep apnea. So I had to go through that whole process, right? And then finally get to the narcolepsy. But by then, it was so far along the way that it was just very hard to treat.
I'm going to go with Sanem.
In Turkey, and people have some prejudice. This makes it difficult for me to get a diagnosis. And I also know level in that an adult individual in Turkey will be financially in difficulty when deciding the diagnosis.
And yeah, I think the prejudice against the condition and the diagnosis and access, I think can be a huge challenge. Shelly, would you talk a little bit about some of the challenges? I'm interested to hear your take as someone who kind of has that fluidity issue when it comes to diagnosis. So.
I, like everybody has said, I think a lack of knowledge within primary care doctors. Like I mentioned, it took probably about 15-ish years for me to get a diagnosis. Despite complaining, I had the same doctor, so it was the same person I was seeing, on a yearly basis, more often than yearly, with the sleepiness and the fatigue and the sleep issues. And he checked my thyroid levels many, many, many times, and they kept coming back that it was okay, and literally never got a referral to a sleep study. I also think, similar to what Kelsey mentioned, I think just societally within the healthcare system, we kind of default to diagnosing depression or anxiety, and not going any further than that. So that it was actually my dentist that ended up asking me if I was tired, and I was like, how do you know that? And that's what got me towards a sleep specialist. But even within the sleep specialist communities here, I'm, I guess, very lucky. In St. Louis, we actually, off the top of my head, I can think of 4 different sleep centers. 2 are, I think, associated with like big universities, and the others are independent sleep centers. But even with that, getting actual treatment, I am currently with my 3rd sleep doctor, and I'm very lucky that I had 3, because I know a lot of people don't. But just getting the treatment and getting people to figure out the diagnosis and what to do with it has been a pretty big challenge.
I think piggybacking off of what you and Kelsey said, for me, it wasn't that the depression was causing the sleepiness. It was that sleepiness was causing the depression. And until I was able to articulate that clearly, and that took me a lot longer than just the one phrase there, it took me years to be able to say that and to say it with confidence in a physician's office. But yeah, I think there's so many challenges, and dentists actually play a huge role in the sleep space. Bruxism grinding your teeth is a common issue related to sleep disorders, particularly sleep apnea, and so it's not surprising, as it might seem, to have a dentist play an invaluable role in finding an answer. Feri, would you like to tell us a little bit about some of the challenges that you've experienced?
As you know, Matt, I have both a view on the USA because that's where I am mainly operating. And then, of course, I have my own experience here in the Netherlands. And I think we all have the same problem in the end. It's the gap between the primary care doctor and the end specialist. And even when you go to a normal neurologist, and like I did, you tell them your cataplexy without knowing what it is, and they have no idea what you are talking about. So it's a problem worldwide to fill that gap, and we all have a lot of work to do there. Now, the only reason I got this diagnosed in 6 months is because I was watching the right TV show at the right time when there was a sleep specialist, a professor, a scientist who wrote a book about all the sleep disorders, and they picked out a few in a talk show where he was telling about the symptoms. And I was half into the show, and then suddenly I hear him explaining cataplexy, and I'm like, hey, I got it. And then he named the second symptom, and I have that too. And then the third, and the fourth, and the fifth, and then I knew, okay, I'm gonna call to a sleep center, and I'm gonna get a study. And then it was done. Luckily, here in the Netherlands, you can go to any specialist that you want. You can get insurance for whatever you need. It still does not solve the gap in between the onset and the final diagnosis, which still is easily up to 10 years. That's the main problem.
No, I think you nailed it. Yeah, and one thing that I think is a common theme between a lot of our stories here is that persistence. It was the person with lived experience was looking for the solution. The solution wasn't necessarily brought to them. They brought the answer to the physician, or at least the symptoms. And you touched on something else there too. I think it's really important for the science and researchers and healthcare practitioners to understand is that medical lexicon, the language that they use, we need to connect that with the patient lexicon. So the word, when we say that we're clumsy or that we're falling down, those are code words for cataplexy. And how do we make sure that physicians and practitioners understand that? So there's a lot of work to be done. And I didn't think we would solve all the problems in a few hours, but it certainly looks like, we've identified a number of problems that exist kind of across the board. But I wanted to kind of wrap up with, number one, if you can name one unmet need, and then if you have a message for the policymakers or the pharmaceutical companies out there, what would that be? And again, how do we find solutions? So focus on that. But what is an unmet need, and what is one message for the policymakers? So I'm going to start with Anna.
Essa pergunta eu escrevi e pedi para a Juliana, vou pedir para ela ler, porque remédio, medicação é um bem público, é um bem comum, porque ele é feito por todos nós, e nós entendemos isso, mas nós precisamos ter acesso, e isso é uma questão de direitos humanos, e eu vou pedir para ela ler o que eu escrevi. Muito obrigada.
I think both questions are connected to her. Said that the need that we don't have solution here is the access to medicine, especially the Xyrem. So, and some difficult in psychological treatment. And she would like to say to the pharmaceutical companies that we respect patents and we know how much investment is made to produce an effective medicine, but we all need to have the right to access medication because science is a public good. And this is a message for the pharmaceutical companies and for the legislator. She thinks that we need to put on an agenda to increase the development of a public sleep health policy and a global pact, sleep global pact, so that the sleep diseases would be considered as a real health problem.
Very well said. And I know that you guys are going to be delivering that message down at World Sleep 2 here soon. So, really looking forward to seeing what you guys are going to bring there as far as solutions. And I love what you said there about let's, finding solutions and working together to make that happen from a global perspective. Thank you, Anna. Let's go with Erdan Anderson, and I would love to, I see that you've got a little trooper there with you.
So I think one unmet need in the United States is going to be sleep health education, and that is starting in grade school and following it in grade school. What does healthy sleep look like? What does it look like when someone is well rested? Going all the way up to undergraduate studies, when they're learning about the basic life sciences, learning about, what's healthy sleep looks like or what unhealthy sleep looks like. And then following that up even further is the medical programs, medical education, having more than just a couple hours in the curriculum for teaching those future doctors, those future providers who are going to be seeing these patients. They're going to be at the front of seeing these patients who are going to be presenting with these symptoms of a potential sleep disorder. And so I think education all around, not just in the public, but also in the medical programs as well. And one thing I think for legislatures, I think trickling down into I would say requirements for accreditation for medical programs for people who are going to be seeing patients with potential sleep disorders is making a required, training, a certain number of hours of training, more than 2 hours for sleep disorders and sleep health as well. I mean, the American Heart Association, just did the changed it from the simple 7 to the essential 8. And so I think, if the AHA thinks it's important, then, the rest of the medical society should as well.
Yeah, no, I love that answer. We spend hopefully spend about a third of our lives asleep, yet physicians are not spending anywhere near that amount of time studying studying about sleep or learning about sleep. And, I truly love what you said about it starting off when they're young, talking to elementary age kids, getting that message out there to young people about about the proper sleep health habits. Diana Brooks.
I have to agree, Anna, Diana. Those are probably the most on the forefront. I think that's what we need to address. I think what is also an unmet need is just awareness in general, and that's what these programs do, what we're doing now. But making it aware to employers. We've had schools, anywhere that anywhere really that you go, right? That you're not, when you have symptoms at work, that you need an accommodation, that you need these things, and that they are given more easier than asking for you to give up all your health records. So we've had just personal experience that way. So going through school, that was a challenge. How many people told my kids they had narcolepsy too? And that wasn't pretty from a mom standpoint. So I would say awareness would be, just across the board, healthy awareness. But starting, if we can just start even with the young kids, like you said, Diana, start with them young, and that will just bring awareness all the way out in the public sector, through schools, through businesses, etc. To the policymakers, that's a loaded question, Matt. I think right now I'll deal with the insurance companies and their lack of ability to make it easy for anybody to get medication. Having to get a prior authorization every time you change insurance companies is absolutely insanity, waste of everybody's time. Not just the patient's time, but the doctor's time. They don't have time for this. When you've got a patient that's been on this medication since they were 15 years old and they're in their 30s, why do we have to have another prior authorization done? Don't understand. And making these medications more affordable for people. And, it's important. We don't have many choices, and the choices that we do have are expensive.
It's a great answer, and I think definitely one that I think intersects both industry but also legislation as well. Want to go to Felicia?
For I think it goes for both Thailand and Indonesia. We don't have, and we do have access to medication, but just the stimulant, like the inexpensive one, we don't have many choices for the medication. And if we do have choices, it will be expensive, and we cannot get access to that easily. So by this I mean I need to go to another hospital or like another province to get that medication. And in Thailand, I don't see many problems because fortunately I have the access to the right hospital. But back then in Indonesia, I need like to travel like few hours just to get medication. And like I say, the Indonesia have many islands, and I only speak from the most developed island in Indonesia because I come from the Java island, and I don't know how people in the other island get their medication. I don't think they have the access to that. And for the legislator, it is so difficult. I mean, yeah, just give easier access to treatment. So if for example, let's say I got diagnosed in Jakarta. I mean, I don't need to go to Jakarta every time I need to get the medication, right? Jakarta is so far from like where I lived. But I do understand that changing system takes time, but hopefully just the at least provides information about sleep disorder. We have like information about what is this sleep disorder, what what types is it, but how do we get access to that? How do we get access to the hospital, to the proper doctor, and what choices that we have about the medication? I think that's the least that they can do. Yeah.
Let's go with Fiona.
The unmet need I'm going to really focus on is the lack of emotional and mental support, especially for newly diagnosed patients. And again, in my opinion, it comes back to a lack of education and understanding among health professionals of the impact narcolepsy has on a patient's entire life. I'd love to see a focus on more patient-centered care, holistic healthcare treatment rather than mainly prescription-based treatment, where an individual's pre-narcolepsy life is discussed and taken into consideration when looking at potential treatment options, so to better assist them in moving forward with their new lives. A support network that assists newly diagnosed patients in transitioning to living with narcolepsy. It could help reduce the grieving process and the impact of the unknown, as they would be provided with valuable and much needed information, guidance and support and insight on what to expect. And it would also help patients, I think, to connect sooner and feel less alone from the very beginning. As well as health professionals such as like psychologists with sleep education and counselors, dietitians, nutritionists, and exercise physiologists. I'd love to see people with lived experience of narcolepsy among the support network, as I believe they would be a great resource in the overall care and adjustment period required to adapt to what is life with narcolepsy. A message, if I would send to pharmaceutical companies and legislators, would be the importance of collaboration between the two. There's so many Australians living with rare diseases and medical conditions who are currently unable to work due to the lack of effective, affordable treatment. And if they, the government and pharmaceutical companies, could just see the monetary gain that would come with providing new, well, to Australia, but already used and proven in other countries, medications that could potentially see us back in the workforce, supporting ourselves, feeling productive and worthwhile, it might be incentive to provide financial assistance, fee waivers and subsidies, etc., to enable the research and development of new drugs and support the pharmaceutical companies to offer them and already existing medications at a more affordable price to the consumers, particularly people with narcolepsy.
Completely on point. That has a lot of global implications there too. Yeah, when you invest in people with narcolepsy, they're going to be able to go out and then produce financially. There'll be economic benefits that you would see by empowering the community. And then, I don't know if you saw, but I gave you a little clap when it came to talking about mental health support when it comes during that early days of diagnosis. I think that would have made such a huge difference in my own journey. So really appreciate those insights, Fiona. Let's go with Kelsey.
When I was first diagnosed, my sleep specialist told me that, this was, so as of yet, there's no cure for narcolepsy, but that once we find the right combination of treatment and dosage, I was going to feel better than I'd felt in years. And I assumed that was a completely pharmacological solution. And that was 3 years plus now, and I have yet to find that right combination of treatment and dosage. I'm still working on that. He did encourage me, because I already had I was already going to see a psychologist. He encouraged me to continue down that route. But my psychologist had no sleep disorder or sleep health experience. So I ended up teaching my psychologist more about what was going on than getting support from my psychologist. And even that didn't happen right away, because before I was diagnosed, knew next to nothing about narcolepsy, and none of my friends or support group knew anything about narcolepsy. And it wasn't until I discovered the Wake Up Narcolepsy support groups that I started really learning that there was more to living with narcolepsy than just taking medication. That there was so much more that I could do to improve my symptoms, improve my life, and I didn't even realize that I was going through a grieving process, or that I needed that support until I got into these groups. So I think that's an unmet need, in that even once you get a diagnosis, the assumption is that medication is going to fix everything, and it won't. And there's so much more to it, and every person is different, and every person is going to have different needs that need to be met. But going to see a therapist is expensive. It's not covered under our universal health care, or it is, but only like in emergent situations, and the wait list is so long that, you know, I'd still be waiting. So you have to pay privately for that. And so yeah, to me, more education just about what it's like to live with narcolepsy, and what it's like to have this invisible illness that so few people understand, and how that can be just as difficult as living with the symptoms. There's just the people not recognizing, you know, what it is you're going through. I saw a meme just the other day that was, you would never tell somebody in a wheelchair, you're so lucky you get to sit down all day. So why would you tell somebody with narcolepsy, you're so lucky you get to nap and sleep all, you know, whenever you want? And it's, no, I don't get to, I have to. So, but how do you would never tell somebody with diabetes, you know, you just need to produce more insulin. So why would you say to somebody with narcolepsy, you just need to produce more orexin in your brain? Like, sure, yeah, I'll get right on that. So yeah, it's that's, to me, is how do you get that message out to the general public? Because I know that everybody on this panel is very well versed in what it's like to live with narcolepsy, and knows more than the average person about what narcolepsy is and how it affects somebody. And probably most of the people who are attending and listening to us do as well. But the people who need to hear the message are you know, not the ones that have logged on, most likely. So how do you get that message out to get us the support and understanding that we need?
I think it all starts with telling the story, and you know, being kind of direct about it. You know, polite but firm is the approach to take, and request what you need. So, Maryanne?
Yes, sitting here, I can see the challenges that we go through in our country is similar to what everyone who has spoken before has echoed. However, also what I may need to add on top of those is, like here in Kenya, we have less than 15 neurospecialists, and we have around 100 psychiatrists, and I think only 2 of them are accessed in the public institution, and 5 trained psychiatrists. And what all these doctors have in common is, when they are in school, they are told like to read more about sleep disorders in their free time, because they might never meet any patient with those conditions. Now you see, access now to the specialists becomes a challenge to the general public, whereby most of us live beyond $1 a day, where we have to make choices like to put meals on our table, or for you to continue with our treatment. Like 2 weeks medication, like for me, usually costs $400 per 2 weeks. So you see, even my earnings are nowhere compared to that. So I'm part of that group who choose to put meals on the table. And then with the rising of $1 in our country and around the globe, so the high medication costs come about because all our medications are imported. And then sleep issues being compared to people. Okay, when you have any sleep issues, you are either, people think that you are either abusing drugs, you are lazy, and then or you are a party person, which is nothing close to the real truth. So awareness is also key, and also access to medication, because if you don't if the private institutions are not like there are not many around the country, like easily accessible is the correct word to put. So if there's challenge to access the hospital, there's access to challenge accessing health advice and also medication. And also what I would like to tell our policymakers, even though most of them have been mentioned here, I think working the Ministry of Health working with Ministry of Education, because the reason why I found myself as an advocate is not the trauma I had in high school, always being stigmatized and doing corporal punishments. So I didn't want any other student to go through what I went through. So the challenge we have with the sleep specialists can be curbed if Ministry of Health and Education work together. And the moment a child or a student shows they have issue with sleep, instead of them being punished, they should start seeking help from there. And all that can only happen if more people living with sleep conditions other than narcolepsy, we join voices as one and do something about it to help the doctors on the other end, so that at least we try to elevate some of those challenges. And then in the recent past, working together with Non-Communicable Diseases Society and Rare Diseases has seen our voices heard by the Ministry of Health, where now rare diseases have been recognized that there's the challenges are real, and the ministry itself was not like prepared, or they didn't know about it, but now they are taking a keen ear on it, and they've even launched a task force to come up with the policies that can assist us. And in the time being, rare conditions, narcolepsy included, we are being covered under the National Council of People Living with Disabilities, because most of the challenges that we're going through require some assistance, and having that ID is key with us. So in the recent years, I know we have a long way to go, but at least the journey has started, and we have something to showcase that we're doing something about it. Yeah, thank you.
Yeah, thank you. I love that. If not me, who attitude of it's my job to speak, because you can't expect other people to do it. And I think that you're doing such a wonderful job in Kenya, but also broadly in Africa, helping to be that voice that so many people need. So, Rorey.
Matt, I'm glad that you called on me, because you know I have sleep attacks at 7. And so
Yeah.
I'm sure the audience absorbed that. Sorry. Let's see, unmet need. I think one of the biggest unmet needs is that we don't have more than one objective test for narcolepsy, other than the spinal tap for orexin. And of course, that is extremely invasive, it's expensive, and it will prohibit people from, getting tested. So I think we need more objective tests. And what would I say to the pharmaceutical companies in particular? I think they need to involve patients more in their drug development processes. And in particular, I think they should do more focus groups with patients, either ones that have had them before, to talk about how do they actually work the medication, what about combinations of different ones, what reactions did you have to those, things like that. I think would give them more insight.
I know that your voice would be a welcome addition to a lot of companies, and they are doing better, but I love the push to say, hey, what can we do more? How can we get more voices across, and how can we make sure that it's a diverse representation of the community? So great suggestion there, Rorey. Let's go with Sanem.
There is only one method diagnosis, considering that its use aid is for people who are unable to what's dangerous and do you seriously possible? About the pediatric patient, it's very difficult for us to get to I would really like to do Thank you.
Let's go with Shelly.
Yeah, I think an unmet need is the lack of easy collaboration between all of the doctors. If we could have some great database or something where, your cardiologist and sleep specialist and just everybody can kind of like lay eyes on patients and cases, I think that would be fantastic. And then if I had one message, it would be that insurance companies should not make medical decisions, period, ever.
I know that there's certainly some legislation out there that's being pushed to hopefully make that relationship between the physician and patient the one that's making the decision. And I've talked to many physicians, and the prior approval process is a huge challenge for them, not just us. And so when you see your physician, just know if they're pushing that drug across with a PA, they're doing just as much work, as a whole. It may not be impacting them quite the same way, but they certainly are doing the effort. And I couldn't agree more. Feri?
I think my comments are more about what others have said, but one unmet need, I would say it would be nice if our physicians start pointing out to their patients that there is social support, whether it is with Wake Up Narcolepsy, who has got these great Zoom hours, or that you join any of the Facebook groups. If you are with 1,600 people on the same medication, with the same problems and the same solutions, it's gonna help you to talk about what you are going through. So it would be nice if our doctors start recognizing that is a certain need for a patient. That's one. For the policymakers, I'm not always proud of my country, but it would be nice if the policymakers in general would look at the sleep center in the Netherlands, because we have, for example, a whole team in those centers with a social worker, a therapist, a technician, the neurologist, and there is even an interim a therapist or a psychologist student that is following the whole practice for a year, so that he can learn and prepare for the future to also be a therapist about sleep problems. And that's a great step forward here.
No, I wish I had something as eloquent to say as so many of you. I would just say that my final takeaway is, besides expressing complete gratitude for you guys taking time out of your day, whether it be your morning, your afternoon, your evening, for coming here. You've given us so much to kind of reflect upon. I think sharing again those commonalities. There are so many shared struggles that I think we could look at a global initiative to help conquer. The power of lived experience, I think, was on display here tonight. You've got people who live with the disease every single day, and they know kind of how we should be moving forward. So again, asking companies to embrace, and my I guess comment for the pharmaceutical companies is to really lean in and embrace like the pre-competitive, non-competitive collaborations. Reducing time to diagnosis would be a great opportunity to help everyone, exceed adding an extra 5 years of quality of life with medications would benefit both the pharmaceutical companies and the greater economy, in addition to people's individual lives. So, finding those places where you can get together and make a difference, I think is huge. And while I do live in a country that has great healthcare, it has great medication access, there are challenges and hurdles to getting access to those beds. So the best medication in the world, if I don't have access to it, is not worth it. I can't access it. I can't receive the benefits of it. So we're trying to figure out and troubleshoot some of those solutions. But living in this country is a privilege, and it's a responsibility for all of us to kind of help raise that awareness level. So thank you guys all for being here. Kara, I just wanted to see if you wanted to make a comment as we log off for the evening. But just again, thank you so much, and I hope that this has been a great start to your World Narcolepsy Day experience, because it certainly has been for me.
Yeah, thank you so much, Matt, for hosting this. It was great hearing from all of you. Thank you, everyone, for taking the time out to be here. It's so exciting to be able to connect with so many people around the world. I want to again thank our sponsors, El Hermes, Avadel Pharmaceuticals, Axum Therapeutics, Jazz Pharmaceuticals, and Takeda Pharmaceutical. Happy World Narcolepsy Day to everyone, and I hope this was a great experience for you guys as well as us.